Good afternoon, everybody. Let me call the meeting to order. We are going to start our press statement meeting, and allow me in the first place to recognize and introduce the Acting Minister of Health, Honorable James Hothmai, who is also the Minister of Labor. I also want to recognize the presence of the WHO WR, Dr. Humphrey Karamaji. I recognize the presence of all the Director Generals in the National Ministry of Health. I also want to recognize the presence of all the media group represented in the room. You are most welcome. And all the other staffs in the Ministry of Health and also the support staff from WHO. Good afternoon.
Good afternoon.
You are all welcome to this important meeting. Like it has been communicated, the reason for why we are here today. So we are here today because we have received a report of confirmed cases of Ebola virus disease in our neighboring country, which is Uganda. And we all understand the fluidity of movement between South Sudan and Uganda. And with this, we just want to alert everybody that we do understand that South Sudan is at very high risk when it comes to Ebola. Being in the neighbor state, it doesn't exempt South Sudan 100% from not contacting the disease. So South Sudan is really at risk of contacting the disease, and it's very important that we start acting now. So now is the time that we should take actions. For this reason, today we have all the important stakeholders in the House, and we are going to invite our Honorable Minister, Honorable James Hothmai, to give us a press statement in that regard, which will clearly give the position of the country in terms of notifying the public and also requesting the public to also take all the precaution measures in place. Thank you, and I will invite the Honorable Minister.
Thank you very much, Under Secretary, members of press, ladies and gentlemen. Good evening, good afternoon.
Good afternoon.
This is a press statement on Ebola virus disease outbreak in Kampala, Uganda. The Minister of Health, South Sudan, would like to inform the general public of a confirmed outbreak of Sudan Ebola virus disease in Kampala, Uganda. This outbreak was confirmed in 32-year-old male nurse, designated as an index case, an employee of Malago National Referral Hospital. The patient presented with a 5-day history of high fever, chest pain, and difficulty in breathing, which later progressed into an unexplained bleeding from multiple body sites. The patient experienced multi-organ failure and succumbed to the illness at Malago National Referral Hospital on 29 January 2025. Post-mortem sample confirmed Sudan Ebola virus disease. Ladies and gentlemen, Ebola is a severe and often fatal virus illness. It is spread through direct contact with infected bodily fluid and contaminated objects. This virus can be transmitted through human-to-human transmission via direct contact through broken skin or mucous membranes with blood or body fluids of a person who is sick or has died from Ebola. Contaminated objects such as medical equipment or personal items that have come into contact with infected body fluids. Close contact with the blood, secretions, organs, or bodily fluids of infected animals such as fruits, bats, chimpanzees, gorillas, monkeys, forest antelopes, or porcupines found sick or dead in the rainforest. The time from when someone gets infected to have symptoms is usually from 2 to 21 days. A person with Ebola can only spread the disease when they have symptoms. People can spread Ebola for as long as their body contains the virus, even after they have died. Symptom of Ebola, ladies and gentlemen. One suspected Ebola case may present with of the following: sudden onset of fever, fatigue, chest pain, diarrhea, vomiting, unexplained bleeding, yellowing of the eyes, restlessness, and headaches. Bleeding manifestation often appear in the late stage after the above symptom. Public health measures. The Ministry of Health has alerted the health authorities in Numili, Juba International Airport, and other points of entry to put in place preparedness and readiness actions, including establishment of screening, holding, and isolation facilities to timely identify suspected cases. The Ministry of Health also urges the public to adhere to the following public health measures. 1. Avoid physical contact with individuals showing signs and symptoms of Ebola. 2. Ensure strict hand hygiene and washing hands regularly with soap and water or using alcoholic-based hand sanitizers. 3. Avoid direct contact with bodily fluids, including urine, blood, sweat, saliva, vomit, and stool from suspected Ebola patients. 4. Avoiding handling bodies of persons dying from Ebola-like symptoms and signs. All burials of persons suspected to have died from Ebola-like symptoms should be supervised by designated health team to ensure safe and dignified procedures. In conclusion, ladies and gentlemen, the Minister of Health would like to reassure the public that government is fully aware of the confirmed Sudan Ebola virus disease in Uganda and has stepped up preparedness and readiness measures to prevent the spillover of the disease to South Sudan. The public is advised to remain calm and avoid panic, and any person showing signs and symptoms of the Ebola should immediately contact the Minister of Health through the toll-free line 6666 for immediate action. Thank you very much, Press.
Thank you.